Welcome to the Omni Dental Podcast. This is the Deep Dive, the show where we take a stack of information articles, research, our own notes, and distill it down into the most important nuggets of knowledge or insight. Think of it as your shortcut to being truly well-informed, packed with surprising facts, and just enough humor to keep you hooked.
And our goal here, it's simple. To cut through the noise and show you not just what's important, but why it actually matters to you. We want to empower you to connect the dots and approach complex topics with confidence, fostering that essential critical thinking.
Exactly. Today, we're really digging into a topic that touches on both health and how you feel about your smile, choosing between dental bonding and veneers. It's a big decision for many, and this deep dive is all about helping you navigate those options so you can make the best choice for your unique needs.
And for this particular deep dive, we're drawing insights from a practice truly at the forefront of personalized dental care, Omni Dental in Arlington Heights. It's led by Dr. Belis Poles, who brings over a decade of experience. Their patient-first approach to empowering confident decisions is really central to our conversation today.
And where's Omni Dental located again?
Right. They're at 305 E Rand Road, Arlington Heights, IL 6004. And they serve a pretty wide area, too, including places like Buffalo Grove, Palatine, Mount Prospect, Rolling Meadows, Schaumburg, Wheeling, Des Plaines, and Elk Grove Village.
Good to know. So covering a lot of ground there.
Definitely. And it all comes back to that patient-first mentality, commitment to trust, expertise, really personalized attention. They also use advanced technology, which helps ensure precise and efficient dental care.
That makes sense. Okay, so when it comes to refining your smile, it feels like there are endless possibilities, right? From subtle tweaks to major transformations. And navigating those choices can be a lot.
It really can.
That's why we're here today, to clarify two of the most popular paths: dental bonding and veneers.
You got it. Both dental bonding and veneers are incredibly popular cosmetic procedures. They're designed to dramatically improve the overall appearance of your smile. But as we'll discover, they achieve that goal in fundamentally different ways, with distinct advantages and considerations.
Okay, let's unpack this, starting with dental bonding. Imagine you've got a small chip on your front tooth, maybe from an unfortunate popcorn kernel incident or a little gap that bothers you. You're weighing your options. The first thing that often comes to mind, or that a dentist might suggest, is dental bonding. What exactly does that involve?
Right. So dental bonding involves applying a tooth-colored resin material directly to the tooth's surface. This isn't just any resin, it's a composite material, basically a blend of plastic and finely ground glass particles.
Okay.
This unique blend allows it to be sculpted directly onto your tooth, making it incredibly versatile. Once it's shaped how the dentist wants it, it's hardened with a special light and then meticulously polished to, blend seamlessly. Seamlessly, right?
And it's known for being a very minimally invasive procedure, which is a big plus for many patients.
So who is bonding best for? What kind of smile concerns does it truly shine at correcting?
Well, it's versatile for several common cosmetic issues, particularly minor ones. Bonding is frequently used to fix, say, misshapen teeth, or to effectively close small gaps between teeth that might bother you, or even to hide small cracks or chips that aren't severe enough to require, more extensive treatment like a crown.
One of the benefits you mentioned for bonding is its versatility, but also it's fast and less invasive. That sounds huge. Can you explain why preserving that natural tooth structure is such a game changer for patients?
It absolutely is. The key insight with bonding is its conservative nature. Because it typically requires little to no enamel removal, it preserves your natural tooth structure.
Right.
This means it's often like a fantastic trial run for a new smile shape or gap closure. It can give you confidence before considering maybe a more permanent change down the road.
Like a test drive for your smile. Exactly. It's a low-commitment way to see your smile's potential. Plus, it's incredibly quick. Often, the entire procedure can be completed in just one visit.
One visit. Wow.
Yeah, and yes, it's generally less expensive than veneers, making it a more accessible option for many people's budgets.
Okay, so bonding sounds incredibly convenient and cost-effective. But what's the typical shelf life for that less durable material? I mean, are we talking about needing touch-ups every year or every 5 years? And how does that factor into the less expensive part over the long run?
That's a great question, because while bonding has many benefits, it is less durable than porcelain. That's the trade-off. It may be more prone to chipping or staining over time, especially if you consume a lot of, stain-inducing foods or drinks. Coffee, tea, red wine.
The usual suspects.
Right. Think of it like this. Because it's a composite, it's a bit more porous than natural enamel or certainly porcelain. That's why it can be more prone to staining over time, much like how a white t-shirt might pick up coffee stains easier than, say, a ceramic mug.
That makes sense.
So, because of this, it might need more frequent dental visits for upkeep or potential touch-ups to maintain its appearance, maybe every 5 to 10 years. Sometimes sooner, it really depends on your habits.
Okay, 5 to 10 years.
So, that long-term maintenance cost is definitely something to factor into the overall equation. It might be less upfront, but you might pay more over time in maintenance.
So, when is bonding the ideal choice for you, our listener, considering all these factors?
Well, if you're looking for minor cosmetic fixes, covering small chips, reshaping just 1 or 2 teeth, or closing small gaps that aren't too wide, bonding is an excellent option.
Got it. Minor fixes.
Yeah, it's also a great solution if you have a limited budget or perhaps if you're seeking a more temporary fix before maybe committing to something like veneers later on.
So bonding sounds like a fantastic quick solution for those minor touch-ups. But what if your smile goals are more ambitious? What if you've always felt your teeth were a little too short or had stubborn discoloration that whitening just couldn't touch?
Right.
That's when we start thinking about a more comprehensive solution. And that brings us to porcelain veneers. How do these differ fundamentally from bonding?
Okay, yeah. Veneers are quite different in their approach. They offer a different kind of transformation altogether. They are thin, custom-made shells, typically crafted from porcelain, that are precisely bonded to the front surface of your teeth.
Thin shells, okay.
Exactly. Porcelain veneers are like tiny, custom-crafted ceramic masterpieces, really. Dental porcelain is incredibly dense and non-porous.
Non-porous, so that resists staining better.
Precisely. That gives it that incredible stain resistance we talked about. It also has this beautiful translucency that mimics your natural tooth enamel. It allows light to pass through and reflect back, giving them a very lifelike, luminous quality, very natural looking. Now, the crucial difference here, and it's a big one, is that veneers usually require some enamel removal from the tooth.
Ah, okay. Enamel removal.
Yes, just a thin layer usually to ensure a proper fit and a natural appearance so the veneer doesn't look bulky. But this makes it a more irreversible procedure compared to bonding.
Irreversible. That's a key distinction.
Absolutely.
And for those bigger smile aspirations you mentioned, what kind of transformations can veneers truly deliver?
Oh, quite significant ones. Veneers are often recommended for people seeking more comprehensive and long-lasting cosmetic results. The real insight with veneers isn't just their longevity, although that's great, but their transformation potential.
Transformation potential.
Yeah, it's about more than just fixing flaws. It's about fundamentally reshaping and brightening your entire smile into something truly new, almost like a complete aesthetic reset that lasts for years.
Yeah.
They are incredibly effective at covering more extensive imperfections, such as significant deep-seated stains that maybe don't respond to whitening treatments.
Right, those tough stains.
Exactly. Or noticeably uneven teeth, or larger gaps that bonding might just not be suitable for or wouldn't last long trying to cover.
So when we talk about this kind of investment, because it sounds like more of an investment,
It generally is, yes.
what are the lasting benefits of choosing porcelain veneers? It sounds like you're getting quite a bit for that investment.
The benefits are significant, especially for longevity and aesthetics. As I mentioned, veneers offer a very natural look and feel. They blend seamlessly with your existing teeth, even mimicking the translucency of natural enamel, which is hard to replicate.
That natural look is important.
Hugely important. They also boast that high stain resistance, meaning they'll maintain their bright appearance much, much better than bonding material over time. And perhaps most notably, with proper oral hygiene, brushing, flossing, regular checkups, veneers can be incredibly durable.
How durable are we talking?
Well, they can last anywhere from 10 to 15 years, sometimes even longer. So they really are a very long-term solution.
10 to 15 years or more. That's impressive.
It is.
And the considerations. Every powerful solution has its trade-offs, as you said. What should someone be aware of before committing to veneers?
Indeed. As we touched on, veneers require some enamel removal. That's irreversible.
Right.
This means that if veneers are ever removed or need replacing in the future, the underlying tooth still need to be protected, often with new veneers or perhaps even crowns. You can't just go back to your original tooth surface.
Okay, that's a big commitment then.
It is. They're also more costly than dental bonding, which reflects their custom nature, the high-quality porcelain material, the durability, and frankly, the artistry involved in their creation and placement.
And it takes longer too, right? Not a single visit.
Correct. Unlike bonding, veneers typically take multiple appointments. There's the initial consultation and planning, then the preparation of the teeth and taking impressions, then the lab custom makes the veneers, and finally, there's the appointment for the actual bonding and polishing. So it's a process.
A process, okay. So given all that, when should someone lean towards veneers? What's the ideal scenario for this particular solution?
Veneers are often the preferred choice if you're looking to address multiple cosmetic issues at once. Think maybe significant staining and uneven teeth, or larger gaps that need a more comprehensive, robust solution.
Addressing multiple things simultaneously.
Yes. They are ideal if you're after long-term results with less day-to-day worry about staining or minor chipping, so less maintenance in that sense. And crucially, if you are comfortable with the necessary enamel removal to achieve that highly aesthetic and exceptionally natural, long-lasting outcome.
So someone really looking for that full smile makeover.
Often, yes. It's frequently the choice for someone seeking a significant, durable improvement to their overall smile aesthetics.
So what does this all mean for you, the listener, trying to make the best decision for your smile? How do you weigh these two powerful options?
Yeah, can feel like a lot to weigh. Ultimately, the choice often comes down to balancing several key factors. You really need to consider the extent of the cosmetic correction needed. Are we talking minor touch-ups or a full smile transformation?
Right. Scale matters.
Absolutely. Your budget, of course, plays a significant role. The desired longevity of the solution is critical. How long do you want the results to last without major intervention? And, as we've discussed, your willingness to undergo some minimal but irreversible enamel removal is a deciding factor for veneers.
So it's a personal calculation.
It really is. It's a conversation with yourself about your goals and priorities, and then, very importantly, a detailed conversation with your dental professional.
Right. So to sum it up, dental bonding is generally quicker, less invasive, and often a more cost-effective option up front for those minor flaws. Or maybe a fantastic temporary fix, or even that trial run we talked about.
Exactly. Quick, conservative, good for small things.
While veneers are the durable, comprehensive long-term solution, they offer that polished, highly stain-resistant, natural, and often transformative look. But they come with a greater investment of time and cost, and the necessity of some enamel removal.
Precisely. You've nailed the core differences. And this really raises an important point. While we've laid out the facts here, a consultation with a qualified dentist is truly key. It's essential.
Why is that consultation so critical?
Because a dentist can properly assess your individual needs, your specific smile goals, and critically, the actual health of your teeth and gums. Not every tooth is suitable for every procedure. And it's worth noting again that Omni Dental, led by Dr. Billis Poles, is deeply committed to providing those personalized treatment plans. They really focus on empowering patients like you to make confident and informed decisions about your oral health. They'll guide you through all the options based on your specific situation, not just give you a generic answer.
That personalized guidance sounds crucial for such a personal decision.
It absolutely is.
Well, we've unpacked a lot today, really digging into the nuances of dental bonding and porcelain veneers. We covered that bonding is, quick, cost-effective for minor flaws, less invasive.
The conservative choice.
While veneers offer that long-lasting, polished, and stain-resistant smile with a truly transformative potential, but require more commitment.
Right. The durable aesthetic powerhouse. And remember, getting that professional guidance is paramount. Omni Dental offers a full range of services, including both of these cosmetic dentistry options we discussed today. And they utilize advanced technology, which helps ensure the best, most predictable outcomes for their patients. They're all about making sure you feel confident in your choices.
So we truly encourage you, if you're thinking about improving your smile, to consider your unique needs and schedule a consultation to really explore these options further. Omni Dental is a local leader in comprehensive dental care in Arlington Heights and those surrounding communities we mentioned. They seem ready to help you on your journey to a healthier, more confident smile.
And this whole discussion, it raises an important question, I think, to leave our listeners with.
Oh, what's that?
Beyond just the aesthetics, how does the confidence you gain from a healthy, radiant smile impact your overall well-being and your daily interactions? Think about how a confident smile can potentially open doors, both personally and professionally. It's more than just teeth.
That's a wonderful thought to leave everyone with. It really connects the procedure to life itself.
Yeah.
That's all for this deep dive. Thank you for joining us.